Okay, what's the lining epithelium here? Okay, high magnification, stratified squamous epithelium. Okay, but what's important is underneath this. Okay, what are these pink hyaline areas here? This one, I think everything here is bundles of pink material. What are those underneath the stratified squamous epithelium? Diagnosis. Nakalimutan nyo na you discussed this skin. Okay, keloid. This is your keloid. Okay. Very important of the overlying stratified squamous epithelium is thin, and as you can see, there's no accompanying adnexal tissue. There's no sebaceous gland. Okay, there's no hair follicle. Okay, so this is your keloid. Underneath, as you can see, made up of bundles of collagen fibers. Okay? Remember that. You've seen that sa that's what's that? M1020. Okay? M1033. Okay, what is the lining epithelium here? What? Pseudostratified columnar epithelium with cilia. Okay. Low power magnification. Okay, see the stroma? Saan nyo ito nakita? Kanina nakita nyo ito. See the mucoid, okay? Myxoid stroma. See, high power. And within the stroma are scattered inflammatory cells. Okay, you see plasma cells. Here, lymphocytes. You have many lymphocytes. Somewhere probably are eosinophils. So this is diagnosis: inflammatory nasal polyps. Okay. At low power magnification, if we look at the other, this is one lesion, but if we go to other lesion, see, this one is densely occupied by inflammatory cells. The polyp. So still, this is your inflammatory nasal polyps. As I've said, inflammation vary in amount. Here, there's a moderate amount of inflammation. Okay, see, and the inflammatory cells you see here. You see eosinophils. Okay, lymphocytes, plasma cells. Okay, and again at low magnification. See blood vessels, congested blood vessels. Okay, here. Okay, that is your inflammatory nasal polyp. Okay, if this will be shown in the practicals, of course, you have to see the lining epithelium like this one. So that you'll know that this is a respiratory epithelium here. Okay, pseudostratified columnar epithelium with cilia, and the stroma shows multiple, numerous inflammatory cells. Okay, that's your inflammatory nasal polyp. This one. Madumi na ako slide. diagnosis. Yeah. Wait, looking at that alone, what do you see?
Keratin pearl.
Keratin pearl, okay. So your diagnosis is squamous cell carcinoma. Okay. So you see this as the most common tumor of the oral cavity, squamous cell carcinoma, the larynx. Okay. So anyway, I think most of you got that. Keratin pearl. See? But as you can see, around it are squamous cells showing around. Though this is your also squamous cells, but the cells around it shows pleomorphism, meaning to say different sizes and shape. Okay, with nucleoli. So atypical cells around, but in areas you see pearl formation, keratin pearl formation. That gives away the diagnosis of squamous cell carcinoma. That was what was that? M1025. Next is M1097. What is this? So you have quite only few slides to remember in head and neck. And this is CNS. What do you think? What's the lesion? What do you think? What is the lesion here? What is this? Black? Crescentic? Okay. Basophilic? Crescentic area? What's that? Ano? Starts with letter P. But it is a silent P. Samoma. These are your samoma bodies. So, with this, sa lecture ni Dr. Raso, let's go back. So, samoma bodies. What is your most probable diagnosis? Look at the cells, okay? They are whirling, low power, low power. See, some of these cells are whirling like this one. This one. And anybody like to give a diagnosis? Almost uniform. Okay, okay. Ano? Meningioma. This is meningioma. Okay, so meningothelial meningioma, almost uniform, ovoid to nuclei with plump yung cytoplasm niya. Okay, slightly eosinophilic, but what gives away the diagnosis is your samoma bodies. Okay, you see samoma bodies. Benign or malignant?
Benign.
Benign. Okay. Narinig ko malignant. Mali. Okay. See again. See the almost yung crescentic structure, layering of your calcification. So this is your samoma bodies, and those cells are your meningothelial cells. So this is meningothelial meningioma. Okay. Last slide. This is more difficult. Let us see. Mahirap. -1 kayo dito. C. Okay, okay. Let's look at the cells. Okay, high power. What do you think? Malignant or benign?
Malignant.
High magnification, definitely this is malignant. Look at the cells. Okay, it's very it is hyperchromatic, very dark. Okay, some are enlarged, shows pleomorphism. Look at those. The background seems to be a tangles of fibrillary material. Okay, so at lower magnification, at this area, look at this area here. So the tumor cells seems to palisade around this. What is this area? Let's go high magnification. Necrosis. See, you see necrosis. Okay, coagulation necrosis. You have multiple inflammatory cells. So this is necrosis, and around this you see palisading of your tumor cells. Okay, now you have an idea what is this? The brain, what? Glioblastoma multiforme. So the component of glioblastoma multiforme, okay, so it has pleomorphic, highly anaplastic malignant cells. You see necrosis. You see endothelial cell proliferation. And dysplasia na. Let's go. You see numerous blood vessels proliferating. Anyway, pag ganitong papakita sa inyo, see this? That's typical of your glioblastoma multiforme. And the fibrillary background, necrosis, atypia, okay? This one, proliferating blood vessels, those red areas. Okay, I think that's it. Your slides, 5 slides for head and neck and CNS.